Welcome back to another episode of Board Bitesize. Today we are joined by our Chief Executive Jim Austin and our Chair Julie Holder. We've just finished this month's board meeting and stepped outside to reflect on what has been discussed today in line with our organisational strategy themes of people at the centre, working in partnership, healthy communities and focus on the future.
Well, hello everybody. It's Jim Austin here again, recording this message at the beginning of December, following our December board, and I'm joined as always by Julie Holder, our chair. Say hello, Julie.
Hello.
Thanks. And between us, we're going to do our normal double act, which covers what we talked about at the board yesterday in public and a little bit in private as well, really based around our four themes. And I'm going to kick off today with the healthy communities theme. And we had a really interesting patient story. We had a couple of colleagues come to talk to us about the IV therapies that we have started doing in Clay Cross, on the community hospital in Clay Cross. Following on some great work that has happened in Buxton previously, and we know that we've done these kind of interventions before, but really listening carefully to the difference it was making for the patient involved, who was having to spend 3 days a week going to Chesterfield Royal to have her therapy. And through providing that service in the community, we were able to take that down to, I think the actual therapy takes about 2 hours to do, but she could get to Clay Cross, it was just around the corner from her house, really easily, and really supports the Darcy principles and the NHS 10-year plan, which is talking about acute to community, a really good example of what we can do in the community that at the moment some people have to do in an acute hospital. But you think it would be simple, it's really hard. We have to make sure that all the nurses and the staff supporting are skilled and competent to do that work. And so we went through some of that detail, really interesting to hear about. We also had spent the first hour of the day as a board, and we've got some new members on the board, going through what we've done as a trust over the last year, looking at health inequalities and trying to make sure that our services, where we improve them, are attending to the most needy. Really good session, and lots of questions, and certainly our new non-exec directors who are around the table were thrilled and fascinated to see the approach we've taken. So really good work there, and we'll talk about that more in the future and make sure that gets publicised. So that was Healthy Communities. Julie, do you want to pick up next?
Yeah, it really was a great session, that first session. It set us up for the day because there was a real theme there that carried us through the rest of the day. At our public board, there was a lot of things where we actually talked about where we're working successfully with partners to provide better services, but also deliver efficiencies in that shift to the left. I was going to also mention our patient story, but in the context of what we heard was that the future was about actually working more in collaboration with Chesterfield Royal Hospital in order to actually allow more people to be seen in the community. We also heard from you in your report how everybody's working together to ease winter pressures, which have really hit us, or people really hard, and you're going to talk a lot about flu, I know, and the great progress that's being made in neighbourhood. And it was really good, as both you and I were at a provider collaboration board meeting where we continue to have that really strong commitment to work in the collaboration space, and that was actually substantiated by a meeting you'd had with the new cluster chief executive Amanda Sullivan, and so that was really good. We're in that provider collaboration meeting. We talked a lot about improving pathways. That was for children and young people, community and neighbourhood, and a range of enabling services. And as you know, I have to take the opportunity of commending people to actually look at the Co-Creating Healthy Futures framework, which I was very fortunate enough to be able to be at the parliamentary reception which launched that framework, and actually on the panel there, and that's actually supporting further collaboration between health and schools. And both you and I are actually starting next year with actually going out to talk to people about how we might be able to use that framework. And I've given you a lovely link, I think, there into all of the things that we talked about around our people, and there was a lot yesterday.
Yeah, so people at the centre, one of our key pillars. I would say we've probably spent 60 or 70% of our time at board talking about people. And it ranged from, I'd had a letter earlier in the week from NHS England saying that we had all seen the prevalence of flu in the communities and in our hospitals absolutely shooting up. And in the national media today, the day we're recording, we are at the highest level of flu admissions to our hospitals at this time of year that we've ever seen. And they're predicting in the next couple of weeks that to get significantly worse. And so we talked at the board around what can we do to improve our flu vaccination uptake from within our staff. And, reminded board that we already have the pretty much the highest target within the Midlands for our flu vaccination rates, and we're on track for doing that. We've had over 2,500 colleagues vaccinated now within the trust, so that's really good. And we'll keep pushing that. Anything that we're pushing us for a target, we've said actually that the target that we've got is a bit of a foundation rather than a cap, and so we will continue to press for vaccinations wherever we can. And I know we're doing that within our wards as well. In fact, as we speak, one of our wards has had to move into isolation because of a flu outbreak there. So, really hard. And if you're listening to this and you're not vaccinated, please do get vaccinated. Lots of opportunities there. And if you're worried about it, there's lots of people on hand through our quality teams, through our nurses, or just through colleagues around what the pros and cons are. So please do take that opportunity. But actually, most of the meeting, we were talking about people's well-being. And we took through some conversations we've had through our committee structures to the board around sickness absence management. I'm going to look everyone squarely in the eye. The sickness absence for last month was over 7% across the trust. Some of that will be flu related. Normally about 1.5% could be related to something like that. But we understand, the pressure people are under, the need, and just the sickness absence that we've got is really putting a lot of strain in. So we talked about the retrospective measures we can put in place to help people back to work safely, how we can manage that more effectively. And we also started to look at the upstream stuff. What can we do to prevent that? And I would say that's probably the thing that's exercising us as a board more than anything else, is just what can we do to help people be fit and healthy at work. So that people at centre was a big theme for us. Jackie Rawlings was there in the audience, our guardian around speaking up, and she reflected back to me after the meeting that it was good to see that a lot of the things that she's picking up come through her channels are being discussed openly at board. So I think I'd like you to take some assurance, those listening to this, that the board really is connecting in with the front line and listening, and we are working to see what we can do to improve things. Back to you, Julie, about the future. And there is a segue there, isn't there?
Yeah, absolutely. I don't think we can say enough that we really are concerned for our people in terms of understanding absence, but actually dealing with helping people to get back into work and understanding the reasons for that. It's often really very difficult when you actually say, well, what have we talked about at the board that actually relates to the future? Because so much of what we do and so much of what people are doing is about the future. I think actually being fit for the future, literally physically fit for the future, is so important. And as somebody that's an asthmatic, Jim, I've always had a flu jab because the fear of actually, I've had flu a few times, and as an asthmatic, it is really it's very uncomfortable and quite life-threatening. So I can't stress enough, for me personally, the importance of having that vaccination. There were a few other things that we talked about, and they might sound a little bit mundane to some, but they were governance matters. But again, they were very much about being fit for the future as an organisation. And that was the things that we're doing to actually become an advanced foundation trust. And to do this, we talked about the process for application, along with the fact that we've had to actually submit a provider capability assessment and further improve our financial management arrangements. But that really does put us in such a good position to be able to lead within the system and as a community foundation trust, as an advanced trust. I was going to leave it there, but I know in this, the last update from us, I think we would both want to thank everyone for all your hard work this year. As I said in my report, I personally feel very lucky that I can spend time with my family over the festive period. Many of you will be working, and that's to allow others to enjoy their festive period. I hope that, as I'm sure Jim will want to say, that you can have some really well-deserved time off as well, and I wish you all well.
Thanks,
Jim, did
Julie.
you want to just finish?
Completely echo that. I do hope people can get a bit of a break over the next few weeks. And although Julie says this is our last update, it's our last update for 2025. We'll be back in 2026. Looking forward to updates from there. But please look after each other as well as you look after our patients. That would be fantastic. Thanks very much.
That's all for today's episode. Board Bite Size will be back after the next public board meeting.